歡迎大家出。
Welcome to the COVID-19 press briefing. With us today, Dr. Albert L., Principal Medical and Health Officer, Communicable Disease Branch of Center for Health Protection, and Dr. Daryl Lee, Chief Manager of the Hospital Authority. Dr. L. will talk about the case situation today. Good morning, good afternoon. As of yesterday, the 6th of May, on the COVID-19 latest update, and yesterday, the number of cases through a PCR test, 115, which include 27 of those confirmed by hospital authority and 27 confirmed by the public health laboratories. The remaining 61 were confirmed by private laboratories. Yesterday, 163 cases found by declared by for the rapid antigen test platform. And now we have 278 positive cases. As of today, under the fifth wave, Hong Kong recorded 119,003,688 cases, about 740,800 positive cases, and 446,000 cases picked up by RAT tests, and 18 of those are imported cases, and 260 cases are locally transmitted cases. Of the 18 imported cases, 10 of which were picked up from the Airport Temporary Specimen Center, with 3 cases arriving from 5th of May on PK083. They came from Czech Republic, US, and then Holland. And 2 cases arrived on 5th of May on flight 5J114, both imported from the Philippines, and 2 cases on the 6th of May on the flight CX829 arriving in Hong Kong, and these 2 are from Canada. There are 3 picked up in airport, 1 in the US arriving on the 6th of May on JL735, and also on the same day on 5J272 from the Philippines, and from France on the 6th of May on KL819. And 7 cases picked up at the quarantine facilities, 2 in the quarantine facilities, and 5 picked up on the 2nd day, and 1 on the 3rd day, and 2 on the 5th day picked up at the quarantine hotel, and 2 were imported from Singapore, 1 from Australia, 1 from France, 1 from Nepal, and 1 from the Holland, and another from Nepal. And the last imported case was picked up on the 12th day in the community testing facility on a 24-year-old female. On 22nd of April, she arrived from Singapore on SQ894, and she was tested negative during the quarantine period, and finally positive on the 15th day. For the genome sequencing, yesterday the public health laboratory conducted an analysis on 76 samples. There's no L452 traces, and 71 actually test negative on that strain, and 5 of them were insufficient virus load. And there's no new residential homes reported new cases, and there's no new cases from the home's previous reported cases. Today is a school holiday, thus there's no new cases reported. And for the week of 3rd to the 6th of May, during these school days, recorded 115 reported cases, which made up of 9% of total caseload. And about 0.72 million students tested, and 125,000 school staff tested as well, made up 11% of the total population. Of these 115 cases, 92 students and 23 school staff, involving 105 schools, made up of about 5% of the total number of schools. The positive rate among students is about 0.013% for the school staff, teaching staff. The cumulative positive rate is about 0.018%, which is within our expectations. And so far, we haven't spotted any outbreak at schools. In terms of mortality, for the 5th wave, the total number of deaths still stand at 9,131, and yesterday there was no new cases reported. The overall mortality rate is at 0.765%, and in the elderly on the age 80 plus, the mortality rate is about 10.46%. The public health laboratories on genomic analysis on the latest cases. Of these imported cases, we found 3 more BA.2.12 and BA.2.12.1 cases. And for the BA.2.12, it's a 36-year-old female. She was asymptomatic on 30th of April. She arrived from Canada, and she tested positive at the airport and sent to the community quarantine facility. And 2 other BA.2.12.1, a 17-year-old female. She was asymptomatic and vaccinated. On the 1st of May, she arrived from the U.S. via Singapore. She was with her family, and she tested positive at the airport and sent to the community isolation facility. And another case is 32-year-old male. He's also vaccinated. On the 3rd of May, he arrived from the U.S. via Japan. And he was tested positive at the airport. On the 5th of May, he started showing his symptoms and sent to the community isolation facility. Well, in summary, currently in Hong Kong recorded 6 cases of BA.2.1.2 involving 2 men and 4 female. They arrived from the 8th to the 30th of April, and 4 tested at the airport, and 2 of them picked up at the quarantine hotel. And 2 of them imported from Australia, 1 from Canada, and 1 from Germany, and 1 from India, and 1 from the US. And currently we recorded a total of 7 BA.2.12.1 involving 2 men and 5 female. They arrived on the April 12th to the May 3rd, and 6 of them positive at the airport, and 1 picked up at the quarantine hotel the day after. Of the 7 cases, 5 imported from the US, 1 from Singapore, and 1 went to US and Singapore during the hibernation period. And yesterday, we detected an outbreak at a restaurant. The location in Yuen Long, Mao Dan Kim Kok Sang Bin Wo Chat Wo in Chinese, involving 4 patrons, 3 male and 1 female. They're aged between 47 to 66. And on the 1st of May, they died between 6:30 to 9 p.m. They didn't know each other. And 2 of the cases tested positive on the 3rd of May, 1 through PCR and 1 through RAT. Another case tested positive on PCR on the 4th of May. And finally, on the last one, the last case tested RAT positive on the 5th of May. And 1 was asymptomatic, and 1 started to have onset on 3rd of May, and 2 on the 4th of May. They are currently under home quarantine. Now that we found there are 7 household close contacts that arranged home quarantine for them. And 1 of them yesterday through the RAT tested positive. We arranged one of the close contact, we arranged a home quarantine. Of these 4 cases, 1 case from the staff of the residential home, Portway Hospital Jockey Club nursing home. And this staff started onset on the 4th of May. Wednesday for attending cleaning duties. He wore enough PPE on the same floor he or she worked. We have defined 3 residents as close contacts, arranged them to undergo quarantine. And one staff who dined with the case was a close contact. Is her last working day on the 6th of May. And through this morning RT, the close contact was tested positive. We arranged this contact to undergo quarantine. And this residential home, so far, we haven't found any residents or staff tested positive. And all the defined residents defined as close contacts are undergoing quarantine. For the restaurant, we will issue a compulsory testing notice. For those on the 1st of May, on 6:30 in the morning and 9 a.m. in the morning, which patronize the restaurants, would need to undergo compulsory testing. In our investigation, we found this restaurant, there were about 50 staff working there, and they're required to undergo RT before starting their work. So far, they're all tested negative. We are asking for patron information for the restaurant. We found that at the same time, there are about 190 customers in that restaurant. We will issue SMS to them reminding them to get tested. We advise the restaurant to undergo thorough cleansing and disinfection. And this morning, we obtained 8 environmental samples, and they are still pending testing.
Dr. Lee, Hospital Authority, please. We have 1,009 confirmed patients who are in North Lantau Hospital Infection Control Center, actually Infectious Disease Center, and AWCTF for treatment. We haven't received any critical cases. One patient is in serious condition. There are 2 critical patients who are in ICU. Today, we don't have any deceased patients. Over the past day, 150 patients have recovered, and 106 have been discharged. For the 5th wave, 48,733 patients have recovered, and 48,103 have been discharged. Since 2020, 61,135 have recovered, and 60,483 have been discharged. 2 were picked up at admission screening, and we have 22,612 staff members who have been confirmed, and 22,472 have returned to their posts. Right, I now throw the floor open for questions. Please wait for the mic and identify the organization you represent. Gentleman over there, please. Cable TV. Now, the Singaporean woman, 24-year-old, what's her viral low lie? Is it a re-positive case? Where has she been? And the Yuen Long restaurant, there are 4 people confirmed. How was the virus transmitted? For the 190 patrons, how many have you identified? And there are news that we're going to need the 4th shot. In the opinion of the CHP, do you think that all the population in Hong Kong should get the 4th shot, or part of them should get a 4th shot? Right, thanks very much for your question. For the day 12 case, she arrived in Hong Kong on 22nd, and she was in a quarantine hotel. And every single day she tested negative. On day 5, she had a PCR test, and she tested negative. She never had any positive record before. And on the 5th of May, at the community testing center, she tested positive, CT value 24, not high, not low. On May 5th, she developed sore throat. Now, this case is under investigation. We will get hold of the sample for genome sequencing to see whether this is an imported case, or whether it is a re-positive case, or whether it is a case acquired locally. After she left the quarantine hotel, she was out and about in the community. We don't rule out the possibility that it might be a locally acquired case, especially as she developed symptoms on the 5th of May. This is the preliminary findings. We don't have the conclusion yet, and we classify initially that this is an imported case. Now, for the restaurant, we try to understand where the 4 people were seated. Now, this is more like a big hall, and they were seated in the middle, scattered at different tables. We believe that in the course of the meal, probably there was a silent transmitter, asymptomatic, who went in, and during the mask-off eating, there was a risk of transmission. Everybody was masked off during the eating time, and there is a chance of transmission. They didn't know one another, but they appeared at the same time in the restaurant, so we believe that it's likely that these 4 people were infected in the course of their meal at the restaurant. We've advised the restaurant to conduct deep cleansing and disinfection, and we also investigated the ventilation. We didn't identify any particular problems, and they do have the air purifier there. We will monitor the situation. At the present moment, we don't have any other cases. We've issued the CTN, compulsory testing notices. We will trace all the other patrons to see what the test results are like. As to the 4th shot, under the CHP, we have the Joint Scientific Committee and also the expert panel under the Chief Executive. They would review the latest scientific data in relation to inoculation and also the overseas recommendations, the WHO recommendations, and then make a recommendation for Hong Kong. Now, for the 4th shot, we advise those 60 and above, they should go for the 4th shot, because if they get infected, the likelihood of hospitalization, complications, and death would be higher. Now, for those who are immunocompromised, they should also be getting the 4th shot. For the other people, the scientific committee is advising 3 shots. In the days to come, as more scientific data become available, and as the immunity wanes, with the passage of time, the scientific committee would have regard to the situation and make their own recommendation then. Lady over there, please. Now TV. The Yunlong case, now for these 4 cases, how many patrons are there at the same table? And the elderly nursing home, what happened there, and how many residents are listed as close contacts? Where do they go for quarantine? Now, for the 190 restaurant patrons, have they received any notices via the Leave Home Safe app, or did they pay by cash or by credit card? Is there a difficulty with contact tracing? For the 4th shot, that the expert panel and there are some experts who said that we should have the 4th shot during winter time, and the other said that we should have population-wide 4th shot. How does the CHP view this, and when are you going to discuss the 4th shot arrangement? Also, the Lok Ma Chau Loop Emergency Hospital has been completed. Is it on reserve? Is it on standby? It is said that the mainland medics will be managing this hospital, and the mainland medics have returned to the mainland. Who is managing the hospital, and what is the role of this hospital? Will there be any infected patients who will be sent to this hospital for treatment? Thanks very much for your question. The first one is about the outbreak in the Yunlong restaurant. We have contacted OGO. When people are all the way into a restaurant, they have to use the vaccine pass, and also they have to scan the Leave Home Safe app. And we are getting hold of the information of the patients who have been to this restaurant. We issue them with the notices and ask them to go get compulsory testing. And the OGO will, through the Leave Home Safe app, issue notices to those patrons who have scanned the Leave Home Safe app, and they will be receiving the SMS notice on the handset. So by the time they get the message. And if they've been to the restaurant on the 1st of May, they should go get PCR test. As to the person working in the care home, in this care home there is a close contact. Now that person did dine with the COVID positive patient, and the last contact was the 4th of May. Now that person is basically responsible for feeding the residents, and she was masked up, and she also had the visor during the feeding process, and she was kitted out with all the precaution. Last day at work, 6th of May, and she developed symptoms on the 6th of May, and she developed, she tested positive and she didn't go back to the care home. Now on the floor, there are 3 residents who were never infected during this wave for over the past 90 days. As a precaution, we have arranged for these residents to go for quarantine at AWE.
For the 4th shot, the scientific committee, based on scientific evidence and also looking at the local epidemic situation, and to offer recommendations on the vaccination, I have nothing to at this point. For the Lok Ma Chau Temporary Hospital, they were made up of 1,100 beds. I know that this temporary hospital will be run and managed by the mainland. While for the AWE mainland delegation came from 20 plus medical units in the Guangdong province. After returning to Guangdong, and together with the River Loop Temporary Hospital, these two have unrelated. Now that the Lok Ma Chau Hospital hasn't been opened yet, I know that the government is currently coordinating, and HA is happy to work with it. Next question, please. Ming Pao Daily News. I would like to ask about the Yuen Long restaurant. Well, for the symptomatic cases, what symptoms are they showing? And since we're sitting in the middle, how far apart from each other? And during their time at the restaurant, how long did they stay for? And just now you mentioned how many persons were at the table. According to Dr. Au, are we having a secondary transmission from the close contact of the residential home passing on to the family members? So far, how many customers have you located? Will they need to undergo quarantine? And if one of them works at the residential home, and how many residents at the residential home? And what is the vaccination rate at that residential home? And how many residents were infected? For the uninfected residents, what are their vaccination status? And what is the risk of an outbreak at the facility? And how do you find out about this outbreak? It seems that you have stopped contact tracing, so how do you find out? And now that we're quite a few public holidays, with a lot of people going out, are they related? Will you expect more outbreaks due to the public holidays? And for the 12th day positive case from Singapore, and have you found out about the genetic genome testing and any cases on the same hotel floor? Asked about the trend of the pandemic. Over the past 4 weeks, it seems that the cases have gradually plateaued. What is the CHP take on this? And Professor Ivan Hong said in 2 weeks it will drop to double digits. And do you see this as likely? And finally, Professor Hong said that we can suspend the circuit breaker mechanism and require arrivals to undergo home quarantine. And when we reach 90% rate for the 3rd shot, that there's no need for arrival quarantine. What is the CHP opinion on this? Thank you for your question. To your first question, for the symptoms of the 4 cases, they were very mild and 1 asymptomatic, and the remaining 3 reported symptoms. However, they're very mild like a slight fever and headache. Since their symptoms were so mild, they don't need to go to the hospital, and they're undergoing home isolation. So second question, we noticed there's transmission, and for restaurant customers after visiting the restaurant, that while at the restaurant, they may be infected by silent carrier or other sources, then reported onset and passed on to others. Looking at the transmissibility of the Omicron, this is well expected since it has high transmissibility. If the patient reported symptoms or detected too late, it may pass on to those around him or her. For these cases, we're defined as local transmitted cases. We believe that the virus strain should be similar to the dominant strain locally. However, we'll still do the genomic analysis, which 2 of the cases are picked up through the PCR. Therefore, we can use the samples for genetic and genomic analysis to see that if they belong to the local dominant strain. In terms of customer contact tracing, well, by working with the Leave Home Safe app and the SMS, we will notify the customers who were in that restaurant at that time to undergo testing and trace their results. From what we gather, there were about 190 customers from 6:30 a.m. to 9 a.m. on the 1st of May. We will issue a CTD end to this effect. For the residential homes, for the 2 cases worked on the 4th floor, and on the 4th floor there are about 30 or so residents, and most of them were infected during the 5th wave, and 3 yet to be infected. We arranged them to undergo quarantine as a safeguard. This residential home, and this morning, well, actually daily, that the uninfected residents need to undergo RAT, and so far they turned out negative. Before the start of the day, the workers are required to undergo RAT. Besides the case I mentioned, the all other staff for today RAT tests all turned out negative. Will maintain close liaison with the residential home and requested them for the residents and the staff who need to undergo RAT daily. For the 12th day positive case, we still carry out an investigation. We'll try to find out if it's a locally transmitted cases or an imported relapse case. The investigation is still underway, and I have nothing to add at this point. For the pandemic development, for the past 5 to 6 days, we see the numbers hovering about 300 level. Compared to 2 to 3 weeks ago, the extent of drop and the rate of decline seems to have slowed down. This may have to do with the relaxation of social distancing measures. Therefore, we expected there will be some transmission in the community, but so far we're not noticing a rebound. For the past week or so, the numbers are pretty stable, and so far we haven't noticed a further decline, so we'll continue to monitor the development. And finally, for the quarantine arrangements, for the overseas arrivals, undergoing hotel quarantine is a very important measure to prevent overseas cases, especially those carrying these variant strain from entering Hong Kong. The government will continue to monitor all the import prevention measures.
Lady over there. TVB doctors. About the Yuen Long restaurant case, there are 4 infected patients were seated in the middle. How far apart are they? So you'll be issuing the CTNs to the other patrons. Now, for the 4 infected people, where have they been after meal? Have they made any declaration about the circuit breaker flight suspension mechanism? At what point of the pandemic would the suspension mechanism be lifted? In connection with the contact tracing of the restaurant, we will cover the patrons who've been there during that time. And we haven't picked up any related cases so far through our tracing. Today is the 7th of May. It happened on the 1st of May. It's been 7 days on. If the patrons there have not undergone any testing, they should go get tested as part of the CTN. We will wait and see whether there are going to be any new cases coming up. From our investigation, we find that this is an open plan seating arrangement. There are no rooms. It is a rectangular shape kind of open plan hall, and these people were seated in the middle. As to the precise number, they probably don't remember, but they remember that they were seated in the middle somewhere. Some were eating with their family members, and all of them are household close contacts, and they are undergoing home quarantine measure. There is one patron who were eating with the infected person, although they were not living together. This is a close contact, also under home quarantine. As to the circuit breaker flight suspension, the FEB has already issued the press release explaining the latest situation. I'm sure that the cross-departmental committee or relevant department will look at the current prevalence situation locally and internationally, and then make the suitable arrangement. That's it for today. Thank you all very much.
大概100
About 190 patrons.
同台係屋企人嚟。
Family members.